HESI EXIT Labor and Delivery Process. Welcome to HESI EXIT Maternity Nursing Labor and Delivery Process. This comprehensive guide will help you understand the stages of labor, physiological changes, and essential nursing interventions during childbirth. Introduction to labor and delivery. Labor is the process of childbirth that involves coordinated physiological changes. Definition. Labor starts with uterine contractions leading to cervical dilation. It culminates in the delivery of the baby and placenta. The process involves multiple stages with distinct characteristics. Signs of labor. Lightening occurs as the baby drops into the pelvis. Bloody show appears as the mucus plug is discharged. Rupture of membranes happens when the amniotic sac breaks. Regular contractions increase in intensity and frequency. These contractions cannot be relieved by rest or position changes. The 5 Ps of labor. Understanding the 5 Ps helps predict labor progress and potential complications. Passenger, fetus, and placenta. Size, position, and presentation of the baby affect delivery. Fetal attitude and lie influence labor progression. Passageway, pelvis and birth canal. Maternal pelvis shape and size determine fit. Flexibility of the birth canal affects delivery. Powers, contractions. Strength of uterine contractions drives labor. Frequency and duration determine effectiveness. Maternal pushing efforts in second stage. Position, maternal positioning. Upright positions use gravity advantageously. Lateral positions may relieve pressure. Position changes can facilitate labor progress. Psychological response. Maternal coping mechanisms affect labor experience. Emotional support improves outcomes. Fear and anxiety can slow labor progress. Stages of labor overview. Labor is divided into 4 distinct stages, each with specific characteristics. Stage 1. Cervical dilation and effacement occur. This is the longest stage of labor. Stage 2. Expulsion of the baby takes place. Active maternal pushing begins. Stage 3. Delivery of the placenta occurs. Shortest stage of labor. Stage 4. Maternal recovery and stabilization. First hours postpartum. Stage 1 dilation and effacement. Stage 1 is divided into 3 phases with distinct characteristics. Early labor, latent phase. Cervix dilates 0 to 3 centimeters. Mild contractions occur every 5 to 30 minutes. Contractions last 30 to 45 seconds. Mother may feel excitement and mild discomfort. Nursing interventions include encouraging rest, hydration, and relaxation techniques. Active labor phase. Cervix dilates 4 to 7 centimeters. Stronger contractions occur every 3 to 5 minutes. Contractions last 45 to 60 seconds. Increased maternal discomfort and anxiety. Nursing interventions include supporting breathing techniques and pain management. Transition phase. Cervix dilates 8 to 10 centimeters. Intense contractions occur every 2 to 3 minutes. Contractions last 60 to 90 seconds. Mother may feel overwhelmed with strong urge to push. Nursing interventions include providing reassurance and monitoring fetal heart rate. Stage 2 pushing and delivery. Stage 2 begins when the cervix is fully dilated and ends with the baby's birth. Characteristics. Cervix is fully dilated at 10 centimeters. Contractions occur every 2 to 3 minutes. Contractions last 60 to 90 seconds. Mother actively pushes with contractions. Duration. First-time mothers, typically 1 to 2 hours. Subsequent births, usually 20 minutes to 1 hour. Nursing interventions. Assist with positioning such as upright, squatting, or side lying. Provide emotional support and encouragement. Monitor fetal heart rate continuously. Assess maternal vital signs regularly. Coach effective pushing techniques. Fetal station and engagement. Fetal station describes the baby's position relative to the mother's pelvis. Station measurements. Zero station means the baby's head is at the level of the ischial spines. +1 to +5 indicates the baby is moving down toward delivery. -1 to -5 means the baby is still high in the pelvis. Engagement occurs when the widest part of the fetal head enters the pelvic inlet. Usually happens in the last weeks of pregnancy for first-time mothers. May not occur until labor begins in subsequent pregnancies. Clinical significance helps predict timing of delivery. Indicates labor progress. Guides positioning interventions. Stage 3 delivery of the placenta. Stage 3 involves the separation and expulsion of the placenta. Timing occurs within 5 to 30 minutes after birth. Prolonged third stage beyond 30 minutes increases bleeding risk. Signs of placental separation. Uterus contracts and rises in the abdomen. Umbilical cord lengthens visibly. Sudden gush of blood appears. Nursing interventions. Monitor for excessive bleeding. Assess placenta for completeness to ensure no retained fragments. Examine for abnormalities. Encourage immediate bonding and breastfeeding to promote uterine contraction. Administer oxytocin as ordered to prevent hemorrhage. Stage 4 maternal recovery. Stage 4 encompasses the first 1 to 2 hours postpartum and is critical for monitoring. Monitoring priorities. Postpartum hemorrhage prevention and detection. Uterine involution ensuring firm fundus. Vital signs every 15 minutes initially. Perineal assessment and care. Pain management. Assessments. Fundal height and firmness. Lochia amount, color, and odor. Bladder distension. Vital signs stability. Encouragement. Skin-to-skin contact with baby. Breastfeeding initiation within the first hour. Maternal hydration and nutrition. Ambulation when stable. Pain management in labor. Effective pain management improves the labor experience. Non-pharmacologic methods. Breathing techniques help maintain focus and oxygenation. Massage and counterpressure relieve discomfort. Hydrotherapy using warm water provides relaxation. Position changes facilitate comfort. Relaxation and visualization techniques. Support from partners and doulas. Pharmacologic methods. Epidural anesthesia typically administered at 4 to 7 centimeters dilation. Provides effective pain relief while allowing awareness. For pain medications like fentanyl or morphine. Pudendal block for perineal anesthesia. Spinal anesthesia for cesarean sections. Fetal heart rate monitoring. Continuous fetal heart rate monitoring assesses fetal well-being during labor. Normal baseline. 110 to 160 beats per minute is reassuring. Variability. Moderate variability, 6 to 25 BPM, indicates fetal well-being. Minimal or absent variability may indicate fetal compromise. Marked variability requires evaluation. Decelerations. Early decelerations are caused by head compression and are benign. Late decelerations result from uteroplacental insufficiency and are concerning. Variable decelerations occur from umbilical cord compression and require intervention. Nursing response. Document patterns accurately. Notify provider of concerning patterns. Implement appropriate interventions. Nursing interventions for fetal distress. Prompt intervention for fetal distress can prevent complications. Immediate actions. Reposition mother to left lateral or hands and knees position. This relieves pressure on the vena cava and improves placental perfusion. Additional interventions. Administer oxygen at 8 to 10 liters via face mask. Increase 4 fluids for hydration and blood volume. Stop oxytocin infusion if in use. Perform vaginal exam to check for cord prolapse. Notify provider immediately. Prepare for possible emergency delivery. Preterm labor. Preterm labor occurs before 37 weeks gestation and requires immediate intervention. Risk factors: infection or inflammation, dehydration, smoking and substance abuse, multiple pregnancies, previous preterm birth. Signs and symptoms: regular uterine contractions, pelvic pressure, low back pain, cervical changes. Treatment: tocolytics such as terbutaline or nifedipine delay labor. Corticosteroids like betamethasone enhance fetal lung maturity. Bed rest and hydration. Antibiotics if infection present. Transfer to facility with neonatal intensive care if needed. Prolonged or difficult labor. Dystocia refers to abnormal or difficult labor progression. Causes: ineffective contractions that are weak or uncoordinated. Fetal malposition including breech or transverse presentation. Cephalopelvic disproportion when baby is too large for pelvis. Complications: maternal exhaustion. Increased infection risk. Fetal distress. Need for operative delivery. Treatment: oxytocin induction to strengthen contractions. Assisted delivery using forceps or vacuum extraction. Cesarean section if vaginal delivery unsafe. Position changes to facilitate descent. Induction and augmentation of labor. Labor may need to be induced or augmented for medical reasons. Indications for induction: post-term pregnancy beyond 42 weeks. Preeclampsia or eclampsia. Fetal distress or growth restriction. Prolonged rupture of membranes. Maternal medical conditions. Methods: oxytocin, pitocin, infusion is most common. Cervical ripening agents include misoprostol and prostaglandins. Mechanical methods like Foley catheter balloon. Amniotomy or artificial rupture of membranes. Monitoring requirements: continuous fetal heart rate monitoring. Frequent contraction assessment. Maternal vital signs. Cervical examinations. Cesarean section. Cesarean delivery is a surgical birth method when vaginal delivery is contraindicated. Indications: fetal distress with concerning heart rate patterns. Breech or transverse fetal presentation. Placenta previa covering the cervix. Previous cesarean section in some cases. Failed labor progression. Multiple gestation complications. Types: low transverse incision is most common and preferred. Classical vertical incision carries higher rupture risk in future pregnancies. Postoperative care. Pain management with medications. Early ambulation to prevent complications. Incision care and monitoring for infection. Emotional support. Breastfeeding assistance. Postpartum nursing care. Immediate postpartum care focuses on maternal stabilization and bonding. Monitoring. Watch for hemorrhage with fundal massage and lochia assessment. Check vital signs regularly. Assess for signs of infection. Pain management. Perineal care with ice packs and sitz baths. Analgesics as ordered. Positioning for comfort. Support. Breastfeeding assistance and education. Emotional support and family bonding. Postpartum depression screening. Education on warning signs. Summary. Let's review the essential concepts. Key takeaways. Understanding the stages of labor improves nursing care and patient support. Pain management options include both non-pharmacologic and pharmacologic methods. Fetal monitoring is crucial for identifying distress early. Recognizing complications allows for timely intervention. Postpartum care ensures smooth maternal recovery. The 5-piece framework helps predict and manage labor progress. Thank you for watching Labor and Delivery Process. You now understand the complex process of childbirth and essential nursing interventions. Your knowledge will help you provide excellent care during this critical time.